If you're sexually active or planning to become sexually active and know that you do not want to become pregnant, then you need to make some choices about what type of birth control you'll use. Hi, I'm Dr. Roshani Sanghani, an endocrinologist, and I'm here to talk to you about how to decide what's the best form of birth control for you. When we are fertile, when we are having a period of our own every month, our hypothalamus and our pituitary, that's the hormone centers in the brain, are making hormones in a regular pattern. And because of that, we ovulate and we make an egg every month. One of the most commonly used forms of birth control is for the woman to take an oral contraceptive pill. When we give you a birth control pill, usually that has estrogen and progesterone both, the body realizes that there's hormone coming from the outside in a steady way, and therefore it does not need to do its rhythmic cyclical hormonal pattern, and that's why you don't ovulate. The other kind of pill, besides the hormone combination pill, is the progesterone-only pill. In this, there is no estrogen being given. There's two ways to take the pill. One is continuous, where you're taking it all month without any breaks, and therefore you may not get any period. Or at the max, you may get about 3 periods to 4 periods in a year. The more common way of taking the pill is you take it for 3 weeks, and then for 7 days, you don't take the pill. When you don't take the pill for 7 days, that's when you get a period, which we call a withdrawal bleed. Most women like to do it this way because they get a reassurance that they're seeing a period every month. Some women don't mind not having a period all year round. That's okay. It's a personal preference. If you miss the pill by more than 6 to 12 hours, you are at risk of your own cycle waking up and possibly releasing an egg for that month. So it's always important to remember to take the pill at the same time every day. If you're going to be traveling while taking the pill, suppose international travel, you need to be careful of the time change. Talk to your doctor so they can help you plan if you're going to be going international. Talk to your doctor if you have any medical conditions such as migraines, high blood pressure, history of breast cancer in the family, history of blood clots. If you have a history of these things, there will be certain pills that we should not use. The other thing is if you have a history of depression, because sometimes birth control pills can affect your mood. Usually, birth control pills are very well tolerated, but you should know they can increase migraines, they can cause slight increase in risk of certain cardiac conditions. That's why you need to take these only under medical supervision. A common misconception or a misunderstanding that being on a birth control pill prevents them from getting pregnant later on. This is not true. The minute you stop the birth control pill, the brain starts to wake up and it starts to make the hormones again, which is why it's so important to take the birth control pill on time. The same logic is when you stop the birth control pill, within a month or two, your periods will come back to the natural rhythm that they had before the pill was started. So you really don't need to worry about your fertility becoming less because of the birth control pill. That's just not true. And with that, until next time, stay tuned and stay glamorous.